In an ambitious drive to eradicate AIDS and HIV in children by the year 2030, the Global Alliance has brought together a diverse coalition of multi-sectoral stakeholders, including women living with HIV, their families, national governments, and various global partners. This strategic alliance, working with the Department of Health and Education, is key to enable social impact that has a direct positive impact on our economy. South Africa's patron to the alliance, Humile Mashatile, joins us as we break down this global challenge and what social implications they have to ensure they overcome in order to see a positive outcome. Humile, thank you so much for joining me for this conversation. What an ambitious target, 2030 to eradicate it. Where are we sitting now with the numbers of women and children with HIV and AIDS?
Thank you so much, Zanele. Currently, we are sitting at about more than 270,000 children that are HIV positive and actually living with HIV/AIDS. And we have more than 75,000 children which are not known, that are not on treatment. So that is a number for me that is quite concerning. That how do we then reach the 75,000 that is not on treatment, that is not on any other ART treatments? So how do we get them into treatment and for them to be able to sustainably actually remain on treatment?
So when we look at people on treatment now, women and children, I would assume that women and the children should be more or less on par on antiretrovirals.
Currently not so. I think with the trend that we are seeing is that children between the ages of 3 and 5, they're the ones that are able to, or rather, actually being infected by HIV/AIDS. So that's an indication that the parents could be on ARV treatments, but the children are not. So that's where we find the most infections actually. So there's this huge concern on our side as to why are these stats increasing rather than decreasing if the parents are on ART treatments, or rather are the parents actually, the mothers, being infected after delivery. So it's a holistic plan that we need to look at in terms of from the pediatric care at the healthcare facility as to how then do we look at from when a girl or adolescent is delivering right up until when they're nursing and the children go for vaccinations. What treatment are we doing? Are we taking treatments? Are we able to provide them the necessary testing for the children during the vaccination period? So on the call treatments as and when the children go for the vaccinations, that is a gap I think we need to be able to fill in order to see those numbers coming down.
And if you don't see and do it correct between the ages of 3 and 5, what happens then to the statistics when 6 to 9 and even kids in high school? Do we see them there being much more empowered to have access to ARVs? Because, you know, it's so rare to hear of any ARV treatment conversations happening at the school-going age.
And it's actually quite interesting, Zanele. We had this conversation, of course, with the Department of Education together with the Department of Health, that it should be a conversation and actually education that we provide to the healthcare system and together with the healthcare system to the education system, so that we empower the young adolescents that are actually currently sexually active as to how to be able to take care of themselves, and if they are actually sexually active, teach them about HIV/AIDS and how to be able to eliminate or prevent HIV transmission within their sexuality. So having groups as well within the schooling area whereby they're able to talk about such conversations, and influence as well that are able to talk about actually promoting HIV testing in the schooling system and of course within their community, because largely we know that of course, I mean, our young children, they're mostly on their phones. So then how then do we talk to them so that they understand that HIV/AIDS is a pandemic, rather it's actually affecting them as well, as young as they are. So
And so for me, the Global Alliance that's coming up now, we sometimes forget that a social impact issue has an economic issue. Why Global Alliance? How are they funding this, and what are they hoping to do for economies that are participating in this particular drive to eradicate HIV and AIDS by 2030?
So Global Alliance actually has came on board to go with the Global Fund. So that includes various UN agencies, the UNICEF, UNAID, WHO. So they see the need for us to be improving our healthcare system and of course eradicating HIV/AIDS within our healthcare system. So they've taken it upon themselves to be funding South Africa in particular, actually globally. But of course, I mean, every single country has their own differences as to what the social dynamics are. So they have really invested within our country and within the healthcare system in order for them to see that our healthcare system improves and that HIV/AIDS strategically we're able to eliminate that, because we know that it's got social impacts and economic impacts. We know that a child who is HIV positive cannot be able to grow and thrive, finish their tertiary education and work, in order to support their families. So this has an impact, economically when it comes to our families. So ensuring that we eliminate HIV/AIDS, and coming on board with these collaborations with the UN funding agencies. Yes, we still need some more collaborations with the other funders, because we have to take this down right into community level. So having donors and funders to be able to drive this mission so that our communities can further be educated, and also ensure that our children can be able to also have the proper ART treatments as and when they need them at the healthcare facilities.
Because we need citizens that can contribute to the economy, right? And a thriving community, thriving individuals are definitely key to the economy. But the Department of Health, this is not coming to them on the back of not enough effort. I mean, there's quite a bit the Department of Health is still doing to run with ARV. At some point, we had a very good program on ARV distribution. Are you aware currently of what the efforts are that are matching what the Global Alliance is providing South Africa?
Yeah, currently the National Development Plan, which ought also to include how we eradicate HIV/AIDS in our country, is all stipulated in the National Development Plan of South Africa within their healthcare system. So all those plans are in place, but also what the department is doing, they're also empowering healthcare practitioners, capacitating them so that they can be able to know how to identify and provide the necessary support, be it through them providing them support as and when they arrive, especially adolescents when they arrive at hospital, also that they're not stigmatized, so providing them with that psychological assistance, and also for them at a pediatric level, capacitating healthcare workers so they know how to treat adolescents during that period. So the government has really done drastically a lot of changes, but also bringing about the data that we currently have as to where these children is brought about through the Department of Health, and seeing how can we be able to find these children. We're working with different NGOs such as PEPFAR, which ensure that at least at local level, community level, the healthcare workers can be able to work with the NGOs in order to bring about those children into the healthcare system for them to get treatment or to be initiated into ARTs.
Now, to take you down a step, I mean, you work in communities directly, and there's an element of poverty and desperation that leads women into situations where they can't really seek the help that they need, or they can't find themselves having safe space. Does GBV play in a role in women just being empowered for themselves, and then also for their own children who have ARVs? Is there a link between these two?
Definitely is a link. So currently, with being on the ground, there's a few initiatives and actually programs that we've outlined. There's the Dreams Project, which actually hopes to outline and empower young women and girls for them to be able to get the education and the support so that they're not dependent on anyone, for them to be able to, or feel vulnerable to be having HIV/AIDS. So we provide empowerment programs, we educate them, and provide support as well, monetary support, for them to be able to know that they don't have to be dependent, or rather on anyone else, in order for them to survive. So these initiatives should be rolled out throughout the country with the Dreams Project, because I think ultimately this goes down to socioeconomic issues that, of course, our communities are facing, and they then feel vulnerable in terms of being infected, or actually being affected infected and affected by HIV/AIDS. So empowering our communities and our young girls and boys is the first point of call that we should actually start to look at as a country. Well, as a patron, I think it's something that's very close to me to say, how do we then change the economic dynamics within our communities in order for us to see that there will be a change, within what we're trying to ultimately achieve. And this involves empowering our communities, of course, educating as well, and alleviating poverty. So we've actually partnered with the Department of Social Development to see how they can be able to provide us with the data, and of course see how they can be able to provide us with data and information and food as well for some of these families that are destitute, because mainly we know that it's what drives most of these women and young girls into being affected or infected by HIV/AIDS.
You're having to deal with so much. So you're dealing with on-the-ground challenges and issues, working with the Department of Social Services. But now you're also going to the Global Alliance. A conference has been held in Germany. I think it's around about next week. Yes. And this really must be a daunting task, because you're also having to open up doors for collaboration among so many structures within our own government system. It's a daunting task. How do you think you're going to tackle it? What for you is going to make the biggest impact if you get that right first?
I think mostly I'm looking at the collaboration with all the different alliances and strategically aligning ourselves as to what we ought to be achieving by 2030. Of course, this entails various research and actually changing the laws as well. Meeting with the lawmakers, and even in South Africa, we've been engaging with the various law entities so that we can be able to change the laws, so that our children and as well as adolescents cannot be vulnerable towards ending AIDS, but the laws can also protect them in that space. Of course, there's various initiatives as well as ensuring that we can be able to do research. There's research that's actually coming up that we want to be seeing about, that I'm looking forward to be hearing about, as to how best can we be able to tackle HIV/AIDS based on the various innovations and the research that is out there. So seeing how can we be able to take that and implement it in South Africa, for me that's that'd be actually quite an interesting one, and collaborating with the various countries as well to see what they are doing so that we can implement it as well in South Africa, or rather tailor make it so that it suits our people and our social dynamics as well.
And Humile, I think it sounds good that you are leading with data and data guiding what you do, and also best practice from different countries. But the focus oftentimes in South Africa has moved away from HIV and AIDS. It's moved away from gender-based violence. What we see are the political stories taking shape, the economic stories taking shape, as well as climate change. You're competing for attention. How do you see us needing to open up people's minds and hearts again to the struggle of HIV and AIDS? It's a tough question.
It is a tough one, but I think, looking at the stats and also looking at how best we can be able to approach this is looking at our social dynamics, that currently we're sitting at a number of 270,000 children living with HIV and AIDS. Now, these are young adults or young children that will be the next generation, which will come into the economy in the next 5 years and be actively participating in the economy. Now, as South Africa, there's a huge, pool of young people. But now, if we're having this struggle whereby we cannot be able to tackle this 270,000, it will multiply, whereby we don't have a generation that's able to take care of the economy and run the economy, and they won't be able to sustain their families. And so if you're going to look at it from not just a small number, but to look at it from how it's going to be able to drive the economy, ultimately, if we cannot be able to address the issues that we are currently having, that as a thriving and young economy as well, we can be able to, we might just have a detriment in terms of how the outcome of how we see our generation currently in the next 20 years. We might be having the same dynamics we had 20, 30 years ago, because we have not addressed and actually seen that our healthcare system is able to support these young adults and young girls, breastfeeding girls and children as well, so they can be able to thrive and actually ultimately achieve their dreams. So it's really a holistic approach that we need to address, because ultimately it will affect the country if we don't address it with the departments and globally.
And I'm worried about asking you the next question, because I think that being the wife to the Deputy President puts you in a very interesting position in the work that you are doing. But what most people won't know is that you've been doing a lot of this kind of work, so it made sense for you to be nominated into this kind of role. But does your access to him open doors and enable you to be heard, to be seen, and to make this collaboration work as intended by the Global Alliance when you were given this role as a patron?
I think also the appropriate term is it enables. It enables.
It enables. Yes, I tried my best.
Yeah.
Does it enable?
It does enable all of us to be able to sit on a round table with all the various stakeholders and international investors as to what are they doing in order for us to end AIDS by 2030. So it does provide that platform as we're able to constructively engage and get all the leaders and decision makers on the table in order for them to account as to what are they doing and what steps and implementation plans do we have in place in order for us to ensure that we're able to meet our objectives by 2030 and we don't sit by 2025 or 28 with no plans and no action in place. So it has enabled me quite a lot, but also it has provided me the platform to be able to bring about collaboration and funding, you know, with the various entities, because they are seeing the importance that South Africa is actually moving quite drastically in terms of how and taking this matter quite seriously. So I mean, of course with donors, it needs to be able to, for them to be able to invest, they need to see that there is a drive and a change that the country is doing. They just provide, they will come through in order to fill in the necessary gaps. But as a country, we're really consolidating and ensuring that we're putting our resources in order for us to move forward in order to end AIDS by 2030.
And on the back of that, there are other initiatives you've been driving. You're even busy right now in the Western Cape providing relief to some of people impacted by the floods. So out of all the work that you're doing, this work has chosen you. Or have you chosen this work? And do you feel prepared, I think, for the long haul? Because it's a number of years ahead and you've got a big target. And you're speaking now about the target, but we'll be coming back to you and asking you, you know, what has happened towards you achieving. How does this weigh on you?
I think, well, currently I believe that it's something that I'm very passionate about. I mean, I'm very passionate about children and, of course, empowering young girls in order for them to thrive, but also providing the necessary education for them. So being a patron at Global Alliance, I think it brings about that international platform for us to be able to have a voice as South Africans, for us to put ourselves out there to say, these are the issues that we're facing. Let's collaborate with the various entities and understand how we can be able to come forth in terms of what research do you guys have in order to improve our healthcare system, and how can various entities, UNICEF, provide the necessary treatments for our system so it can alleviate that burden within our system, a healthcare system. So partnering with the various NGOs, I think the Global Alliance provides that platform, and I think I'm quite excited to be a part of it, and I'm looking forward to the trip next week.
And we'll be keeping in touch with you to see how that has gone. I think one final question is, there's so much work that needs to get done, and sometimes we get caught up in the bad news stories, right? We get caught up in the bad news stories, but South Africa's also got a good news story to tell, even about HIV and AIDS and the work that's behind it. So when you go forward into the Alliance, how then do you speak of South Africa and what South Africa has done and is committed to continue to do to turn the curve and get to a point where we eradicate HIV and AIDS?
And South Africa, Zanele, has done so well when it comes to ensuring that our healthcare system and the availability of ART treatments throughout our facilities and hospitals. We've done tremendously well. And I mean, this treatment was not really readily available at some point, but government has really invested in ensuring that all the clinics and the hospitals have treatment, and they provide the necessary therapy as well. So within the next chapter of being part of a Global Alliance is actually for the global market, actually, to know that South Africa has invested within the healthcare system, and there's data that proves what we are doing in terms of the interventions and also that how we're seeing that the treatments people that are on treatment, if their viral load is suppressed. So all these stats is a clear indication that our government has actually made it a clear directive together with the SANAC and all the other affiliates as to how we can be able to end AIDS within our communities. So globally, seeing that, of course, we're interacting with other countries and of course other strategic alliances, I think it's imperative for us to be able to look at, to say how best then are we able to take our next foot and ensure that we end AIDS, of course having the necessary tools and resources in order to outroll this countrywide, even at community level.
You know, we're probably going to have to come back and circle on the conversation around private institutions in South Africa, because ultimately there's a social impact directive and a responsibility that weighs on them. When do you think you'll start to enter the private space, and how are you enabled in this role to even come back and have the energy, the time, the space, and the resources to do that?
And you touched on a very critical point, actually, because of course some of the work that I'll be doing will be engaging with the private sector and having triple Ps with the various entities in terms of seeing how they can be able to collaborate with us and be improving our infrastructure in hospitals, the pediatric cares in various hospitals within the government sector, within the government hospitals, seeing how we can be able to collaborate with the private sector to improve it. So I think involving the private sector is important, because at this point in time, government can only do so much, but the private sector, as part of their CSI, they've got the initiative and the mandate actually to be able to give back and see how their corporate social investments are able to of course, most of them want to see results as to what is their money going into. But of course, seeing projects like this, whereby we've got community-based projects as well as nationally, whereby we account together with UN funding, so ensuring that, seeing how can we be able to collaborate with corporates is something that we're going to have to look at as soon as I come back from. But I'd really want to take them on in order for them to get involved in their communities and to be investing within this cause, because ultimately it's that workforce that's going to be affected into where they'll actually be ultimately be placed. So ensuring that at least we eradicate AIDS, and within the adolescence area, it's ultimately it will affect their workmanship. So supporting it and ensuring that at least we've got that pool of funding for us to be able to work with community leaders and with various departments can assist us quite a lot. So really engaging with corporates is quite important.
Thank you so much. That was Humile Mashatile, patron for the Global Alliance to End HIV/AIDS in Children. And I think what's key to this is to understand the social impact is economic impact. And this is critical work to enable society, communities, and businesses to thrive in the future. Well, that's it for this series. Thank you so much for joining us.